Hello, and thank you for tuning in today. I am Christiane Williams. I just a few things about me and my background. I've been in law enforcement for the last 27 years. I am currently now an employee at the Mississippi Department of Correction and the founder of Leading by Example, a mental health awareness company that I actually formed and started and created myself. Today, I am glad that you all tuned in with us. We will be discussing identifying crisis for formerly incarcerated once returning home. As I had told many before, I actually changed the title. The reason I changed the title from inmates to formerly incarcerated is to provide hope, HOPE, so that they can look back and say, I once was, but this is me now. So when we go through this presentation today, we're going to discuss some of the things that they face on a daily basis. But first, one of the things that I want you all, because I do believe in we having an engaging and an exciting presentation. I am not one to do the boring. So I want you all to participate on this short exercise. If you have a piece of paper with you, I would like for you to jot down these 4 or 5 words. We're going to say 5. Write down the word base, BASE. Then write down the word healthy, HEALTHY. Then write down the word hand, HAND. Write cow, COW. And then I want you to write computer, COMPUTER. Okay, now that you have those, give you a few seconds because I know if you like me, the spelling is not always, but just spell it to the way you can understand it for yourself. But beside each one of those words, I want you to write down the first thing that comes to your mind. So let's go back to the word base. What's the first thing that come to your mind? Just write whatever word it is, write it beside it. The next word, healthy, write down whatever come to your mind. Then we go to hand. You're going to write down the first word that come to your mind. We're not checking for spelling, not at all. The next one is cow, the first word that come to your mind. The next word is computer, the first word that come to your mind. Now, we got those words written down, and I'm going to do my list. And I'll tell you what I have. And generally, if we was in front of each other at this point, I would ask for 2 or 3 volunteers, and you would stand up and you would read what you have. And whatever, if somebody else in the room have the same thing that you have, we would raise our hand. Just say, just raise your hand and let everybody see what you have. And then we would take a tally at the end to just find out who all had the same, who all did not. So for my first word, I wrote base, and then I had line, healthy, life, hand, full, computer, games. Now, most, probably some, and might even none, have anything that I have. But some of them may have, some of you all may have, some of you may not. So the reason I like to do this is how do we think? Typically, when we see words, situations, or anything, we always think about why did somebody say that? You all may be saying, why did Christiane say baseline? What was on her mind? But we have to go back to people react to their upbringings, religious belief, cultural background. It could be just how you feel in that particular day, just walking in wherever that you're at. So when we talking about persons that's incarcerated, we typically try to figure out why Christiane, I'm using myself, did this, that, whatever it is to get her into the system. We never know a person's background until we actually talk to that individual, and then we don't always understand it. So we'll go ahead and get started with identifying crisis as formerly incarcerated once returning home. And as I said, I did change it from the word inmate. So if you see it somewhere, it may say inmate, and we have changed it. The first thing we're going to talk about is mental health. When we're talking about mental health is something, it's nothing to be ashamed of. Everybody have mental health. We got to be mental health awareness. That's the part of being aware of your mental health. That's the purpose of taking classes like this here. It's nothing to be ashamed of. Is not contagious. And as you see, I'm not going to read each slide word by word because I want to have a discussion with you about the things that people face once coming home. Mental health is just like any other condition, but it's a illness of the brain. It's just like any physical mental in a physical condition that you may have. We would take the precautions, we'll take the medications, we'll change our diet, we'll do all the things necessary to get physically healthy again. We can do the same thing when it comes to mental health. Mental health is you can recover from it. You can live a healthy life. And it doesn't matter if you've been incarcerated. Sometimes incarceration also make the mental health comes out a little bit more. I put it that way. You start to see things in a different perspective. Persons that's been incarcerated, or is it the person that has been incarcerated, that is incarcerated? Their mental health is a big proponent of them getting back out and not reoffended and going back into the system. So that's one of the reasons why we started this presentation. Statistically, 1 in 5 of us, and I'll be number 5. I'm always taking a part of it. 1 in 5 of us will deal with some type of mental illness in a particular year. There's no way around it. If we went around the room, we was all in the room together. If it was 50 of us, we can take 1 in 5. Somebody's going to deal with it. 1 in 20 statistically adults have a serious mental health issue in one particular year. And then we go to our youth, 1 in 6 for those of us who deal with youth. And even as adult probation and community corrections, some of our probationers are becoming younger and younger. We may have them 15, 16 years old. I have had one that was 15 years old that I was actually taken to school to make sure that she was in school. So 1 in 6 deal with mental illness in a particular time. And the thing about it, a lot of people don't want to accept that it may be something going on and don't want to tell anybody. And that's how people end up back into the criminal justice system. Discussion summary. These are just some things that we're going to discuss today. Facing parole and probation is one of the things that people always have about when they're coming back home. How am I going to get to my PO? What am I going to do? How's my PO is going to be to me? What things are they going to be required to do? Are we going to have a great relationship? These are just some of the things that, I've presented this here inside of the prisons here in Mississippi numerous of times. And these are just some of the things that I'm sharing with you, my cohorts, is things that they're shared with me. And these are persons that's actually incarcerated. Currently, right now, Mississippi has a reentry academy that they have implemented throughout all the facilities, that persons in the facilities or in the incarcerated has to complete this 200-hour curriculum for part of their presumptive parole qualification and eligibility. So I teach the mental health awareness, and what I'm giving you is raw information that I just been given from them. So I did tell them I'm going to share this with my cohorts within the next year or so. So I'm just trying to keep my promise to them. So that's part of the facing probation parole thing. Adjustment disorder, coming back into a world they know nothing about. And then we're talking about placement disorder. Being placed back in certain places, is it the same environment? Is it a different environment? These are just some of the things that they are facing. And their mental health and substance abuse is one of the biggest things why people repeat offenders and go back into the system. Going back to the same life that they left is not going to be productive for them to be productive probationers, parolees, once they're released. Our objective at the end of this session, participants will have a better understanding the issues Mississippians and others face after returning home from incarceration. As you know, I did say I do work for the Department of Correction, but I think this here presentation is something that is valid throughout any state in the United States. It's going to be because it doesn't change what they're facing. It's just that what changes is the location and the situation that they're in, or the territory that they're in. So when it comes to probation and parole, or returning back home after incarceration, I think this is just something that is just across the board for everybody, no matter where you're at. One of the questions that I get from them, and I think that when we talk to them about returning back, is what are probation and parole. Some do know, most do know what is probation parole, but I was speaking to some people that had never had a history of the criminal justice system, whether they work for it or inside of it. This is the section that you got to make sure that we explain to them what exactly is probation, what is parole, what is required of that person. These are just questions that they ask me. How many times are they going to have to report in? Why do the PO have to come to their house? I'm trying to think of all the things, it's quite a bit of things that they're asking. Will they be able to see their kids? How can they go back and stay? Why they can't stay in certain places when it comes to probation parole. One of the things I've learned as a probation officer was when it comes to subsidized housing, which we'll get over into that later on, people can't get their address approved to come home because of where the family is staying and they have a conviction. They're not allowed. Again, these are some of the crises that they face once they return home. They're not able to live where they want to live at because of the crime that they have committed, or they are on some type of supervision. So these are some things that are asked by them during the question and answering session. And then I also give them the opportunity when I'm presenting this to persons incarcerated to ask questions in this time. And one of the things I did tell them about documentation for them own self. If they're going to the probation or parole office, if their officer's not there, asking whomever they spoke with, can you document that I came? If that person does not document what they come, then I told them keep the documentation themselves. Get them a notepad. They need to have some kind of documentation throughout their entire supervision of what they've been doing, and not just leave it up to us to document it, because we're still human. We may make a mistake, but at the same time, I advise them to make sure they get theirs and to document it themselves. So that's the segment on probation and parole that we always have pretty much a very lengthy discussion on what is. So I tell everybody, just kind of be open to what they want to ask you. I also included this about my great state of Mississippi. We got the number of persons that's on probation. You can find this information on the prison policy, and you can pull up your state and put your particular state in, put your state name. It's going to give you the number of persons that's currently on any type of supervision in your state. As you see, Mississippi currently have 29,000 people on probation in the state of Mississippi. That is a lot. Yes, we are one of the highest incarcerated state in the United States. So we have quite a few people that's on some type of supervisions. And in our state prison, we got over 17,000 people that's actually incarcerated in the state prison. So I would suggest during your time, or you can jot down. You also see it at the end on the resource, the prison policy. It is a great resource for us, for community corrections, for probation, for anybody in the criminal justice systems to rely on. The prison policy has a lot of great information. So I would suggest that you make sure that you jot that down and go back and look at your state. These are just some more facts when it comes to, we reiterate, 1 in 5 deal with mental health. 1 in 20 experience serious mental health illness. And then 1 in 6 youth, we go back over that. 50% of all lifetime mental health begin by the age of 14 and 75% by 24. Suicide is the second leading cause of death for people among the age of 10 to 14. And I put that 10 to 14 in there because we are getting some young offenders. Seem like they're getting younger and younger. So I was hesitant, but I decided to leave it in there because I thought it was valid. Because we really don't know who we're going to end up supervising during our tenure in our position. So I left it in there. Some of the most common mental illness conditions faced by recently released prisoners include post-traumatic stress disorder, PTSD, post-incarceration syndrome, substance abuse, anxiety, depression, and manic. One of the things when I was doing this and putting this presentation together, and I didn't really think about it, was the post-incarceration syndrome. And that is something, generally when I present this, we have a long discussion about the post-incarceration syndromes, because persons that has been incarcerated, the environment that they're placed in, what they witness, how long they're there, solitary confinement. That's a lot of things to pile on being incarcerated, away from your family. It's a lot of things that persons incarcerated go through. So these are just some of the most common mental health condition that they actually face. Adjustment disorder, a group of symptoms such as stress, feeling sad or hopelessness, or physical symptoms that occur after you go through a stressful life event. I read that because if we weren't talking about persons incarcerated, we all could fall into that category of adjustment disorder, adjusting to a new position. We all know, I'll use myself for an example. For this here training, I had to adjust. I was trying to figure out, how am I gonna get this here done? I wasn't feeling sad or hopeless, but I was anxious. And I almost thought I was stressing myself out for a minute. But I'm so grateful for APPA for helping me out. So we all have to adjust at some point in our lives. How do we cope with it? How do we get it? But think about a person that's been incarcerated coming back home into an environment that they have not been in, whether it's 1 year to 20 years to, it might be somebody that's been incarcerated 30 years and now they're coming back. They have no idea what they're walking back into. And to be honest, the home that they're walking back into with the persons in there, you really don't know. Everybody has to adjust to one another. Another body that's been in the house, that's been in a completely different world environment that we're bringing back into our home. So what do we do at this point? The person who's been incarcerated is probably feeling a whole lot of different feelings about where they at, how people look at them, what they're feeling. Do they have, it's a lot of things. What do they put on? How they're going to get from point A to point B? There's a lot of things when we're talking about adjustment disorder that people actually go through once they're returning home. Adjustment disorder after incarceration. Post-incarceration syndrome is it's a psychotic disorder effect. The individuals who have been incarcerated and that has been released back to society. So we're coming back home, or they're coming back home, back into a situation where a lot of times if they see things, they're not able to say anything, because most times people are going to say, you just getting out of jail. How you going to tell me something? We don't want to hear, how you going to tell me something when you couldn't even keep yourself straight? These are just some of the post-incarceration syndrome, the PICS, that people actually have to deal with when they're coming back home. It could go from anything from emotional to social difficulties, just trying to fit in, to have a conversation and feel comfortable around, honestly, your family. We're not even get to the friends. A lot of times what the guys shared with me and some of the ladies, coming back, just trying to being a parent to your child after you've been incarcerated and that child has been raised by somebody else. These are just some of the things that they share with me that really, really is part of them, back trying to get back adjusted after incarceration. If we look at statistically, we got 2.3 million people in the United States who are incarcerated or formerly, collectively. That's a lot of people that has been incarcerated. And these are just some of the consequences that they share. Many cannot vote. They can't get a driver's license. They have faced barriers about employment, and they prohibited from living with the family. We addressed that earlier, trying to go back into a situation where you can't go because of your charge. And we're going to dive over into this here when you're talking about many can't vote. In Mississippi, you have to go to the Secretary of State's office, and it tells the persons, according to your charge, there are some charges that people have that you still can vote. You still have your voting privileges, but you got to distinguish what's your charge and what the state says. So these are just some of the things, or just some of the resources that you can advise your people to go and trying to obtain a driver's license. We're going to talk about that a little bit more because each state have their own. And then the barriers for employment, that's what we hear all the time where they say, check the box. Do you have to check the box? So these are just some of the things that they actually face once returning home. Communities among incarcerated people with mental illness. Statistically, it says non-white individual more likely to go to solitary confinement, be injured, or stay longer in jail. That's just, prison policy is where I got it from. I did research it, and I found it 2 or 3 other places that they are more likely, non-whites, to actually, and that goes back to a lot of time the stigma that's been placed on it, because typically in the African American community, mental illness is not a subject that is talked about in a vast way that we need to talk about. And a lot of times it ended up with the person back in the criminal justice system on a repeat offender because never receiving the proper help that they need. Access to care is one of the reasons that persons end up back in the criminal justice system when it comes to mental illness. Not having access to care, what a history of mental illness. So you think about, and I always use this here, if a person has mental health conditions, illness, never get into treatment, start to experience drugs, alcohol, and then a child is born out of that. If that child becomes a part of the criminal justice system, that's a lot to peel back until get to the core of the problem, and you find out it's a mental health issue. So access to care is very important. Sometimes people never get care until they get in the criminal justice system. So imagine a person who never had care and becomes a part of the criminal justice system. What do you do then with that person? At that point, honestly, we only just could be able to probably keep patching and patching until hopefully we pray, hopefully that person get back to the point that they are functionable within society. So that's one of the reasons why we got to make sure we give persons access to care if possible. Criminal justice, about 2 million people each year with serious mental illness are booked into jail. This is where you can become, if we was live in front of each other, this is the point where I will ask you, do you know what the largest mental health holding facilities are in the United States? So I usually will give you a few minutes to try to figure out what are the largest mental health holding facilities in the United States. But being that we are on virtual, I'll go ahead and we're going to give you a few minutes to think, or a few seconds. Now, I will share it with you. It's jails and prisons. And I'm quite sure you probably already figured it out from the presentation here. Cook County, Illinois, Rikers Islands, LA County Jail. Those are our largest 3 mental health holding facilities in the United States. They house more persons with mental illness than any mental health facility in the United States. So if you're from that area, If you can get the statistics of how many persons with mental illness in your facility, it will be a good thing to have, a good resource to have to your, it'd be to your advantage. I would suggest that. Nearly 1 in 4 people shot and killed by police officers between 2015 and 2020 had a mental illness. Suicide is the leading cause of death for persons in jail, and it's estimated about 4,000 people with serious mental illness is in solitary confinement in the United States. That's a lot of people. Mental illness is real. Persons incarcerated and returning home do have to find, we have to make sure that we give them the resources that we know that's available if they ask for the help. Prison people with serious mental illness are 10 times more likely to be incarcerated in state facilities and receive treatment in a state hospital. And that kind of goes back to what I was saying to you earlier. And also, if you see again, this one came off the prison policy website. And you think about it, persons with mental illness coming through the state academy. Just recently, I taught a CIT class, and I asked a question. We had over 106 years of experience in that class. And I asked the question, how many in this class, when you went through the state academy, received mental health training? Nobody. Out of I think it was 15 people in the class, nobody had received mental health training while in the state police academy. And that's the same thing when it comes to us as probation, parole officer in the criminal justice field. We have to make a conservative effort to start getting some type of training on mental health and what we need to look for, and to help ourselves help them. Some of the most common mental health conditions, we talked about them earlier. For a person most recently released, PTSD and post-incarceration syndrome, substance abuse. 3 of them that I kind of want to highlight a little bit more, especially the post, and because most times if they can't deal with what they're having or the issues that they got in front of them, they're going to result back to what they know, and that's going to be the substance abuse, whether it's drugs, alcohol, or both, a combination. Those are the things that we got to make sure that we kind of head off. If we see it happening, or just make that suggestion, about going to whatever, services provided to you, or if you know about them, make sure that you be like a resource for your people. I know we have a lot on our plate, but I think we do need to be a resource. It's not bad, to actually get a little small resource guide. If you need help, these are places to go, or these are some, information you can call, or somebody, just make sure we try to do our part, help them, be a help to them. Mental illness escalated individual risk of recidivism or relapse into the criminal justice system. No matter your situation, adjusting to life after prison is difficult and requires ongoing support. And that's where we come in as their probation parole officers, or a person that's in the criminal justice system. We have to support them. We all, the second chance, I believe in second chances, and, we've all been given probably 2 or 3 chances. We just didn't end up in the criminal justice field, just to be quite honest. What can we do as a community to fix this problem? That's where we was in front of each other, where you will be involved. What can we do to fix this problem? What are some things that we're in a position? One of the things I shared with you earlier about becoming have a small resource, guys. Nothing big. It could be a 1-pager. It could be a half a page. Just something to let them know these are some resources that you can get started on. So we'll go over into what can we do, some of the things that I found. These are some gaps in treatment and services. As soon as an inmate leaves prison, they lose their health coverage. Prescription renewal is no longer available without insurance. Former inmates must apply and secure a plan themselves. Access to a smartphone or a computer. Transportation and housing. These are some things that, we take for granted on a consistent basis every day, that we don't think about a person's coming from incarceration coming back into our office, in our society, not just our office, we really have had the presumption that they're going to come back and all these things are readily available for them the day they walk out of prison. That is not so. We're not living in reality if we think, because if we are just being honest, we aren't incarcerated, and we have trouble sometimes actually accessing some of these same things. So imagine a person coming home trying to access this, as opposed to us at home and we still can't get it. So I always try to do that, so we can kind of see exactly how the balance is. What we're asking them to do is some things that we're not able to do ourselves, and we hadn't been incarcerated. This is something that was provided to me by the medical provider for our agency. It is an 800. It's one of the resources. It's health insurance for persons that has been incarcerated. It takes probably about 2 to 3 minutes. If you all have time, I would say jot this down. It is a resource that you can actually go out and you can download this here, actually slide, or if you need it, we'll make sure that you get it. But you can access this. Provided to the people that you're supervising, whether it's in the court system, whether it's local probation through your county, wherever it is, you can access these services at no cost. And it takes, like I say, maybe 2 to 3 minutes. I actually called to try to find out, because I didn't want to provide anything and not know if it actually works. What are some things that your state have in place to assist formerly incarcerated once returning? Find out what your state have. Find out what your reentry program is all about. What is your reentry? Where does the reentry start? Who's over the reentry? How many reentry programs that you actually have in your actual community? Find out what are reentry groups. There's reentry organizations all over. You can just Google it. Find out reentry in Mississippi. It's going to give you the reentry groups that's here. Whatever state that you're in, there is some type of reentry program in your community. So I will always say utilize those services, especially for you and the people that you're supervising. Okay, examples. One of the things we were talking about earlier was the driver's license. And I found some states. Again, by now you do know I'm a Mississippian. So we're going to talk about some things that Mississippi have in some of our surrounding states. And the reason I chose some of the surrounding states, as I told you earlier, I go around to all the facilities and do mental health awareness training for the person in the Reentry Academy. Well, I meet them where they are. And when I found out, when I went to North Mississippi, which is up in the top right-hand corner of Marshall County, as far as north as you possibly can go, I found out I was running into people from Tennessee that was actually incarcerated in Mississippi. When I went to the Gulf Coast, I found out there was Alabama and Louisianans. So I said, okay, let me find out what's available for us around us. So this is what this section is about. It's the provisionary license. And that's one of the things when we're talking about driving, the persons cannot get around. So we're talking about the provisionary license. Oops. Here we go. Mississippi, our great state. In Mississippi, in 2021, they did pass House Bill 551, and I'm not going to read it all to you. The Mississippi Department of Public Safety will issue a driver's license to persons that's formerly incarcerated. And this here usually get a lot of buzz when I present this to them in the facilities, because they want to know everything about, can I get a driver's license? What I need to do. The Department of Public Safety requires their discharge certificate and a photo. And the Department of Corrections do provide that to them in order for them. We try to start this process prior to them getting out, but we know it is not error-free. Everybody's not going to get through the process, but we don't try to hold them because they hadn't got their provisionary license if they qualify. It pretty much tells them what the provisionary license, it will have on the bottom of the driver's license, the provisionary license. This is just something I'm showing you what Mississippi have. Your state may have one also. So this is what I'm suggesting, that you do find out what your state have when it comes to provisionary license for persons that's been recently incarcerated. So these are just some of the things. It lasts for 6 months. It's nothing, no more than 6 months. At the end of that 6 month, it's going to expire. At this point, it's what the provisionary license is available to inmates whose driver's license has been suspended, revoked, or canceled. And this is where I get a lot of you probably get a lot of questions from. You cannot get a driver's license if you have a charge of against somebody like DUI, vehicular homicide, anything like that, a violent charge like that, dealing with an automobile and alcohol. You are not eligible. So a lot of times that's when the air leaves the room, when they find out, no, I can't get a driver's license. I got DUIs here, there. No, you cannot. Child support will not stop you from getting a provisionary license, but it only lasts for 6 months. 6 months and 6 months only in the state of Mississippi. Here's what you can and cannot do. It permits them to go to work, report, church, children activities, anywhere that the probation officer give them permission to. What they cannot do, and I always go back and tell them, I'm sorry about that, concerts, blues shows from Mississippi, parties, activities that have you out late night. I think you guys get it at that point. At this point, it's for the essential things that you need, and not the luxury things that you might want to engage in, the parties, the friend. Here, if the officer catch you driving on a provisionary license, after the time, if you working from 11 to 7, yes, you headed to work. But if you out 11, 12, 1 o'clock and that officer stopped you, you go through a roadblock, you are subject to be arrested, which is going to be a violation of your probation. So that's Mississippi in a nutshell. Louisiana, pretty much the same way as Mississippi. How do you get a driver's license? When you come home from the state of Louisiana, they have a provisionary license. It almost mimics what Mississippi is. But the only thing is, if they've been incarcerated for less than 1 year, you're not eligible for it. And you have to have a current driver's license. Just to go back, if you've never been issued a driver's license in Mississippi and Louisiana, you're not eligible for a driver's license. And it pretty much covers the same thing. It's just you got to be incarcerated in Louisiana at least for a year. Anything less than a year, you're not eligible, but all the other provisions or the eligibilities are just the same for the state of Louisiana. And you have to go to the DMV in the state of Louisiana and get your driver's license there. And it's a Class E driver's license, what you will be actually offered in the state of Louisiana. And then this is the provisionary license. Where do you get them from? It's going to tell you the local license. This is just some information that I found in the state of Louisiana. And again, you know, the third DUI or vehicular homicide, you are not eligible for. And we go to the state of Alabama. As I said, I did my surrounding states. Alabama is a little bit different. With Alabama, it's same provisionary eligibility, but what it is with the state of Alabama, they last for 4 years. And in the state of Alabama, I know that's a little small, it's pretty much the same thing that, you know, church, work, programs, children, grocery, household information. You can still do the same thing. In the state of Alabama, I kind of went to this one a little sooner, and the hardship application, you can reapply each year. Alabama will give you up to 4 years. And for an example, if you had a $4,000 fine, after year 1, you need to show that state that I've knocked that fine down from $4,000 to $3,000. Then you can reapply for up to 3 years until you get everything covered or, you know, paid off, and your license can be renewed or been reinstated. So Alabama give you a little bit more time than my surrounding states. Mississippi 6 months, Louisiana is a year, and Alabama is 4. So I would suggest find out what your state, if your person is telling you, I can't get a driving license, I don't have a driving license, find out what the eligibility requirement is for a provisionary license, because I am hopeful that each state, if they don't have it, will be getting it real soon for provisionary license, to just try to take some of the gaps out of returning back home, you know, once incarceration, some of the things that they are facing, some of the crises. And these are just some of the resources that I actually use You all can still use them. We, of course, instead of NAMI, the National Alliance on Mental Illness, the Mississippi Department of Mental Health. Let me go back to that first. That's our website. It still have information that if you want to use it, you can. It still will give you information and send you over, move you over to the national. Then a National Alliance on Mental Illness, NAMI. We have a NAMI Mississippi chapter also. That's a great resource. And then the National Suicide Prevention Line, it is still open, or the text. And the National Council of State Legislation, that's why I got a lot of the provisionary license information from. And then we got the 988 crisis line. These are just some resources that I think would be very beneficial for you or us as in the criminal justice field to make sure we have to our access. 988 is a crisis line. Every state has it. No matter where you're at, you can call it. There's a live therapist on that line. So it's not just for the persons coming home. It's for us also, our own self-care. I do nothing without talking about us and self-care. So I'm always throw that in no matter what. So 988 is available for everybody. Some more resources. Here it is, 988. They try to make it as easy as possible. You can chat. You can text them. You can call directly to them. Any way that you need to talk to 988, you can talk to them and get help. Help is available for you. It's available for them. It's available for us, for everybody. Here's another one. If you all could go to the 988.com or 988.org, you can just pull up 988, Google it. You know, we're the Google kings and queens. Google 988. If you're in your office, what you can do is you can scan this here. You can download it, print it off, place it throughout your office and your facilities. And you know, it's not just for the persons coming in to report. It may be you or your cohort that actually needs somebody to talk to and now don't want to. And these are just some of the things that people face that they don't want to tell what's going on with them. So, you know, it's just not for the person there. But like I say, the resources is related to the presentation, but it's also for us also. That's another one that you can scan, the QR code that's on there for 988, the crisis lifeline. It works. People need help. And sometimes, even though they're reporting to you, they may not want to tell you something is actually going on with them. So these are just some things that I would suggest that you would just download, print, and just post up around your offices. The Mental Health America. This is a mental health test. No matter what you think you may be going through, I would suggest take a Mental Health America test. It is anonymous. It's going to give you suggestions, what you would need to do, who you would need to talk to. Just being quite frank and transparent. I don't provide anything without trying it myself. I did the test feeling like I'm, you know, Miss Jolly Christiane usually. And so then I used some of the symptoms for some of the mental disorder. Believe me, guys, it does work. It worked. They were probably about to send the paddy wagon for me. So I would suggest that you know, just go on there and try it and just see it. Like I say, it's anonymous. It's a great tool just for you. I would say you utilize it and then see how it works. So that way, when you do give it to the person that you're supervising or whoever you come into contact with, you will actually know. Because if they come in and ask you for help, you can always say, why don't you take this test? It's anonymous, and it'll make suggestion of what you need to do. The reality, leaving prison without guidance, reference, or local connections will be difficult for anyone, but especially those battling a pre-existing mental health condition. And, you know, even if we, you know, it's here, mental health is real. There is no way around it. I am so glad that we're in a position now where we can talk about it so freely and not have that stigma placed on our head. One of the things about persons coming from incarceration back home, they already have that stigma of I'm an inmate. And we got to get them out of that mindset that I am an inmate. One of the things I always try to stress to them, don't allow people to put you in this box that they have created for you. Don't do that. I'm not an in the box person. I've always been called out of the box, a little extra, or whatever it may want to be. But we cannot keep allowing, and we can't keep placing them in the box where we want them at. They are formally incarcerated. They are not the inmates anymore. So that's what we got to make sure that we do what we can on our part as much and be much of a help as we possibly can. And I do know there may become times where we have no alternative but to take them back and incarcerate them again. But let's make sure that we do what is very possible within our power to make sure that we give them the resources. And that means we stand abreast, us in the criminal justice field and system. We got to stay abreast on the legal laws, what they can and cannot do, making sure that we know what resources are available in our community. You know, that's our duty. It's part of our duties to make sure that they get that information. Here, again, here's the reference. Of course, I use myself, 27 years of experience of correction, law enforcement, mental health awareness trainer, which is my current position. I also use the verywellmind.com. I use the prisonpolicy.org, and I would suggest, I go back to the prisonpolicy.org. It has some great information. I will tell you to go and find out. NAMI.org, the National Alliance on Mental Illness. It is a grassroots organization. If you have people on your caseload, or you that's just been diagnosed with anything, or they telling you they're diagnosed, NAMI would train them and their family. They even train you also how to deal with persons with bipolar, schizophrenia. They have all of it. Find out what your local mental health department have. The state mental health department, they have what is called peer support. They are great assets to use. Utilize that. And then I also use the Mississippi Department of Corrections for some of the statistic and data, and also the persons that I spoke to in reference to this presentation. And so these are just some of the resources. But like I said, there are many out there, but these was very instrumental in me putting this presentation together. And this is where we come to the questions, comments, or concerns. But I will make the comments. If you have any questions, you can always send them in. And my concern is making sure that we do our part. We do our part. My concern also is making sure we stay abreast on what is affecting the persons that we're supervising. The comments, I appreciate everybody for tuning in today. This has been a very humbling experience for me today to reach you throughout wherever you may see this presentation at. I hope and pray that it was a blessing to you or a help in you and your everyday experience and work life, making sure. But one of the most important things that I want to make sure is we talk about is self-care for us. We got to make sure that we take care of ourselves. We're in a position now that a lot of things are happening when it's come to us as probation, parole officers, just in the criminal justice field. So not just, we identifying crisis for formerly incarcerated once returning home, but as this is my last minute spiel, when I always do at the end of any presentation, when I'm talking to to us, I say me, us, our co-workers, it's self-care. We got to make sure officer wellness and self-care. But again, I do appreciate everything for APPA allowing me to have this platform. And I appreciate you all for tuning in. And if you all have any questions or concern, feel free to reach out to me directly. On the APP, I am the Mississippi State Rep for American Probation and Parole. Thank you again, and I appreciate it.